That's the one, right? Yeah.
Yep. So, sorry, have we started?
Yeah. Yeah.
Okay, so maybe I should say hello. Usually a signal is helpful. Okay, anyway. Hello, everyone. Hi, my name is Gina Lucarelli. I'm the team leader for Knowledge and Innovation at the UN Development Operations Coordination Office. Thanks so much for joining us for today's webinar, where we will talk about real-time monitoring. What could and should you be monitoring once a year? We've got a really great panel here for you all, and we're really thrilled to have several countries online who are actually trying to apply real-time monitoring to their UN development assistance frameworks that they're just at the very start of designing. So really thrilled to be with you today. Before I hand over to the speakers, let me just give a few words of introduction. First, logistics. We will use the questions chat box for a Q&A. It's usually the easiest way rather than trying to enable mics. If you really want to speak, we can definitely try. But at any time during the presentations, if you have questions, please put them in the question chat box. Help us out here by putting in brackets the country you're working in, because that'll help us target responses and also follow up in case we're not able to address all the questions. So please, at any moment, put your questions in the chat box and let us know what country you're working in. So let me just give a few words of introduction here before I introduce our speakers. Many of you know that clearly 2015 is a transition year. It's a moment where the UN system is lining itself up to a new set of sustainable development goals that will be adopted in September. Since we have a fair idea of the parameters of that framework, we can already begin to line up the way we work and what we're planning on delivering together with governments over the next 5 to 7 years. So in the spirit of this transition, we at DOCO put in place a UNDAF Design Innovation Facility, and this is really meant to help us promote UNDAFs that are three things. First, UNDAFs that are better informed by data and analytics. Secondly, UNDAFs that use citizen engagement and promote more accountability for the partnership of the UN and government. And thirdly, UNDAFs which tackle the specific elements of sustainable development, notably that it balances economic, social, and environmental goals, and there's more of an integrated approach needed for sustainable development. So today we're going to zero in on one critical aspect of these new generations of UNDAFs that we're looking for, those that are better informed by data and analytics. So we'll be talking today about real-time monitoring. Let me introduce our panel and give you an idea of the flow that we're going to follow before I hand over. So we have with us Charles Katende, is the Chief of Strategic Information and Knowledge Management at UNFPA. Gabriele Fontana, the health specialist and health systems at UNICEF. And Charles and Gabriele have been working together with a broader team on some draft UNDG guidance, specifically in this area of real and frequent monitoring, to supplement the current UNDAF guidance that focuses more on annual monitoring and multi-year evaluation. We also have with us colleagues from World Food Program, Jean-Martin Bauer, the team leader of Food Security Monitoring, and Emblem, which is an acronym that Jean-Martin is going to tell us about in a few minutes, and Marie-Anne Lund, who's a food security analyst at WFP. We may have on the line, I apologize, I'm not sure, Anush Tatevasian from UN Global Pulse, who can talk to us a little bit about using big data for real-time monitoring. So the flow that we'll follow here is we'll start with an introduction to the UNDG guidance that is underway in this area. We'll hear a little bit about the why and what of joint frequent monitoring or joint real-time monitoring. And then we'll go into a second session on how you choose what to monitor in real time. So a sort of linear process that walks us through exactly what to measure in order to make corrective actions on the program. So then we'll open up for Q&A, and then we'll move to some examples, primarily from World Food Program, the MVAM work, and then we'll close up with next steps at the country level. As I said, any moment, please let us know what your questions are and put them in the chat box. So I'm going to hand over to Charles. Floor is yours.
Thank you, Gina, and good morning, colleagues here. Good afternoon, colleagues in the field, different time zones. And as mentioned, the topic of today is about joint frequent monitoring for equitable results. And I would like to say that all the terminologies, all the words used in this topic have a very clear meaning why they are used there. And there is a big justification why we want to go that route as the UN family. So my role will be really to talk a little bit about why do we want to do joint frequent monitoring for equitable results. First, as you all know, we are transitioning to the SDGs. And in the current document about SDGs, it is clearly stated that development, sustainable development, people have to be at the center of sustainable development. By people meaning that we must have everybody on board as we move on the development path. Nobody should be left behind, whether it is by age, sex, disability, culture, race, ethnicity, origin, migration status, and so on and so forth. And so that's why one of the reasons that we have this word in this is equitable results, because this means that everybody, especially the disadvantaged, are on board in this. So we all know that in the current development landscape, the resources are limited. So there's competition for resources. So development work has to compete for resources. And so when you combine the two, the people-centered development, the limited resources, all these have led to calls for increasing monitoring for results, especially at the beneficiary level, so that we can see that everybody is included. Because when you monitor at beneficiary level, you have the advantage of making sure that the most disadvantaged are included as you monitor the results. So it's not just monitoring results, monitoring for equitable, so that we are having everybody on board. Amidst all this, the UN is going through reforms. The QCPR, as you all know, has called for harmonization of approaches, the delivery as one, and strengthening of results monitoring. All these are to make the UN more responsive, more fit for purpose, and more effective in delivering development for all. So that calls for the frequent monitoring, actually, because frequent monitoring is an improvement. It is a strengthening of results monitoring. Then we have this technological revolution that is giving us opportunities to be able to do things we were never able to do before. We are now able to do real-time monitoring, whereby we can monitor as things happen in the field. The examples of rapid SMS, the U report, this is Rwanda and Uganda, if you have all heard of them. These are good examples where this has been done, where you can monitor on the spot what's going on and give information and feedback to the managers to be able to make decisions. And we all know that previously the UN has had a gap somewhere in its results monitoring. The tendency was to monitor our activities because we are in charge of activities, so we can easily monitor the activities that we have implemented. And then at the end of the day, monitor the outcomes because the surveys were providing the data so that we could see at the outcome level the behavior change. So while you start at monitoring, for example, the number of doctors trained, and from there you look at the percentage of women that have received the services at the high level. But in between, there are several levels of results, which we could call intermediate results, that hitherto we weren't really focusing on in the UN. So, and those levels of results are actually they are very they are very easily, they need to be monitored because they give you information in the period between achieving the activities and the outcome. So it's very critical to monitor those because if you don't monitor, you will not be able to do corrective action. For example, to rectify why you're not going to be achieving the outcome level results. So these are some of the reasons why you would want to embrace frequent monitoring for equitable results. It provides you actionable, timely information, focusing on critical elements of the theory of change. Those are the intermediate results. The bottlenecks, because those are the elements that prevent the interventions from making a difference. The critical assumptions. I give you an example. There was a program on adolescents, and the assumption was that if you strengthen the education systems, they could get education and they would get the knowledge. But because they didn't do this mapping, they didn't monitor the assumption of whether the girls would actually attend the schools. And so happens the girls were not attending the schools. So those kind of levels in between your activities and the outcomes are what we now need to think about a lot and start addressing if we are to really monitor to achieve our results. And of course, the term joint is there for a purpose. Joint because when we monitor jointly as a UN, we are more effective, we become more fit for purpose. We don't put a lot of burden because we don't have different agencies asking for the same data on the same person in the national office. So we are basically introducing more efficiency and becoming more fit for purpose. And because this frequent monitoring builds on these innovative systems like the real-time monitoring, because it builds on those systems, in effect, it strengthens the national capacity. Because one of the principles, as we'll hear from the next speaker, is that this approach needs to build on existing systems if it is to be successful. And so by doing that, you're building on existing innovations, and by that means you are scaling up innovations in countries and strengthening M&E systems. And of course, we know that we have no excuse. Frequent monitoring is now a best practice. Actually, it has happened in different countries, and there's we have no excuse for we can't say we don't know about it. We know about it. We know it's a good practice, so we need to embrace it. At the headquarter level, I know that it has been endorsed. There was, for example, last year letter from heads of agencies calling upon UN cities to really consider this good practice of frequent monitoring for equitable results. So in a nutshell, I think these are some of the reasons why you would want to embrace, why you would want to think of, why would you want to plan real-time monitoring. And so I think at this stage, I will hand over to Gina to lead more to the next presentations, which basically come from, now if we know this is what we want to do, maybe if we all agree we need to do this, what is it done? What is it? How is it done? The next speaker, I think, will be speaking about it. Thank you very much.
Fantastic. Thank you, Charles. So I'm going to just hand it over to Gabriele. Very easy for me.
Okay. Good morning or afternoon or evening, depending where you are. I'm Gabriele Fontana. As Gina said, I work at UNICEF on health systems, but I also have done some amount of work on improving the way we program, we plan, and we monitor internally and with partners. So what I'm going to talk about during my contribution are the following points. First of all, let me define what I will not be talking about. I want to talk about what is already happening, and that is at country level through the UNDAF, the identification of theme, priorities, and outcomes, with the identification of usually annual indicators to measure progress at outcome level. And we have all the guidance to do that, and we have the guidance also on the M&E framework for the UNDAF. And also monitoring the inputs in terms of what we do as agencies. That is already done by individual agencies. So all of that is a given to this presentation, and we won't go through that. We want to discuss an addition to it, that is what is not happening. That is the identification of intermediate results to be monitored frequently to assess the effectiveness of the strategies that us as UN agencies are implementing to support countries and governments to achieve the UNDAF outcomes. And that is usually, or what we are trying to talk about, is a frequent monitoring that triggers corrective actions. I will go in detail about that later on. The approach is divided in three main steps. One step is the program development or program analysis, depending on which part of the UNDAF we found ourselves. Another step is about the indicators development. And the last step is about data management strategies and the costing of those. Now, in the rest of my contribution, I will be explaining these three steps. And this is based on experience in a number of countries and sectors, and on the field work that was done in Malawi by a multi-agency team last year. And we have Kahol from the Malawi RC office online, and after my presentation, I hope he'll be able to tell us about their experience with this approach. Now, one disclaimer, my slides go against the good principles of communication. There is too much text and they are boring, but that is because I try to make them self-explanatory so that once they are circulated, colleagues can just use them to go over what we discussed and also to share the content with other colleagues. So I will just highlight the main points in the different slides. I will not go through each slide in detail. Okay. So these are the three main steps, and as you can see, we already divided them in a number of sub-steps to make it more complicated. In terms of program analysis, we have the prioritization of program interventions, followed by bottleneck analysis, identification of solutions to bottlenecks, and identification of the information that we need to monitor frequently. Once we have identified what information we want to monitor frequently, we transform that information into indicators. Those indicators need to be tested in terms of whether they're useful to improve the management of our programs.
Sorry. Just wanted to check the chat box there. Go ahead.
And we also look at the availability of the data and the sensitivity of the data to the changes that are expected in programs. Again, I will explain that more in detail. Then the third step is the data management strategies and cost. So if the data, we have to basically make sure that the data that we need to populate the indicators are available or can be collected and analyzed with a reasonable effort. And if that's not the case, if they're not available, we have to decide which are the strategies that we will put in place to make those data available and of good quality, and what is the cost implication. Now, let me go through the steps one by one to explain what we mean by each one of them. Now, prioritize program interventions. UNDAF outcomes are usually achieved through a number of interventions that are mainly carried out by the government, but supported by UN agencies. Now, to understand what we're talking about, we have some examples of interventions like provision of neonatal care services, primary education, forestation and land reclamation, promotion of small and medium enterprise, vitamin A supplementation and iron fortification, and flour fortification or iron and folic acid supplementation. This is for nutrition, sanitation and hygiene. We have promotion of hygiene like hand washing or use of safe water, protective services for children, PMTCT, which is the prevention of mother-to-child transmission of HIV, enforcement of timely justice, public program-based budgeting, etc. As you can see, we just picked a few interventions across different sectors to give different colleagues an idea of what we're talking about, colleagues coming from different sectors and ways of life. Now, how do we prioritize interventions in a given, for a given UNDAF outcome? Well, UNDAF outcomes are addressing main deprivations. And we look at which are the causes of those deprivations and which are the groups that are most affected by those deprivations. So we also want to apply an equity lens to try to reach the unreached or the most deprived. And we select the main interventions that are supported by the UN. I have a few examples. I will, in the slides, I will only comment on a couple of them, and then I will circulate the slides so that you can look at the rest of them. But let me go, for instance, through health. When I say a main deprivation, what do I mean? Well, if we have high mortality of children under 5, that's what we identify as a deprivation in a country. And the cause, just for the sake of the example, could be malaria. Now, the group most affected could be children living in a rural area, and the intervention for malaria, we have basically 3 interventions, is treatment, spraying of households, and use of mosquito bed nets. And let's say that use of mosquito bed nets is prioritized because it's the most effective one. Another example could be education. The main deprivation is girls that have low learning achievements in primary school. The cause of that is high dropout rates and high absenteeism of girls in primary school. The group that is most affected are girls living in the north of the country. Again, this is for the sake of the example. And the main intervention would be to support the complete cycle of primary schooling. Now, once we have identified an intervention, for that intervention we carry out a bottleneck analysis. What is a bottleneck analysis? A bottleneck analysis is a way to systematically identify if there are problems in delivering that intervention and supporting that intervention. The bottleneck analysis that we are describing and referring to here is pitched at a programmatic and operational level, while there is a bottleneck analysis described in the MDG acceleration framework that is pitched at a higher level, at a more strategic level. So what we do in the bottleneck analysis for the intervention that we have prioritized, we look at the enabling environment. That includes policies, laws, financing and budgeting issues, management and accountability issues, social norms. We look at the supply side, which includes availability of essential commodities, of trained human resources, geographic accessibility to the delivery points of services. We look at the demand side. Usually we look at the utilization rate of services to assess whether there are financial barriers, socio-cultural barriers, issues with dropout. And finally, we look also at quality, which is usually measured in terms of adherence to standards and procedures, sometimes also looking at customer satisfaction. Now, the example in health for a bottleneck in terms of use of bed nets could be simply the lack of bed nets for distribution in health facilities. And for education, the bottleneck could be that girls drop out of school because parents prefer them to help in running the household rather than going to school. The next step is to find solutions that address the causes of the bottlenecks we have identified for the key strategies. These are main acceleration strategies to address the bottlenecks, and they have to follow a clear theory of change. Now, let me digress for a second and comment what do we mean by theory of change, because people might mean different ways, and we have a sort of a simplified concept of a theory of change. So allow me to go through it quickly, just to make sure that we're all on the same page. when the process I'm describing is basically a program interventions-based analysis, which, as we said, is a program analysis of program development if we are at the beginning of the UNDAF. So we look at the main deprivation addressed by the UNDAF outcome. As we said, we look at the causes of the deprivation, at the groups that are most affected, at the main intervention supported by the UN agencies to address the deprivation, and at the bottlenecks that are preventing us from delivering those interventions to the target population. Based on those bottlenecks, we identify the solutions supported by the UN agencies. This is what I've described so far. Now, the theory of change behind it is that when we implement our solutions, which means we support as UN agencies, we support the implementation of those solutions, often implemented directly by government and partners. What we want to see is that those bottlenecks that we had identified are addressed. For instance, if we said that the bottleneck was lack of bed nets, addressing the bottleneck could be procuring bed nets, and the bottleneck would be addressed because now the bed nets are available in health facilities for distribution. That should lead to increased coverage of the key interventions. In my example, more people are sleeping under bed nets, which means that less people will get sick with malaria and die because of malaria. So you see the arrows going up are highlighting our theory of change that we have been uncovering through our analysis and that will inform our program activities and actions. Now, to identify solutions and strategies, we identify the solution that will be supported by the UN agencies, and we look at what that support is going to be. This is something that very often we already monitor. Sorry, stop. This is the example for health. Improve procurement of supply and bed nets in rural areas is the solution. What we do as UN agencies is support the Ministry of Health in the procurement of the bed nets. And the way we measure it, and this is something that is already happening, usually we do already monitor our inputs as UN agencies, we look at the number of bed nets procured and sent to rural areas compared to the needs. If we're talking of education, well, the solution can be engaged with families of girls with high absenteeism to ensure they support schooling of their daughters. And as UN agencies, we would support establishing village education committees to engage with families of those girls. What we usually monitor already is the number of village education committees instituted and functional compared to the needs. Now, what is the information that we need to monitor frequently? What we want to monitor frequently is information that can flag a lack of results at intermediate level, so that we can take prompt corrective measures. Usually this means we want to measure the reduction of the bottleneck. To measure how many children are sleeping under a bed net takes usually a household survey. To measure the dropout of girls from primary school, it usually takes at least 1 year of schooling to look at the dropout. Absenteeism is something that we can monitor more frequently. But stockouts of bed nets, for instance, is something that we can monitor frequently. So if our actions as UN agencies are not leading to reducing the stockouts of bed nets, we are very unlikely to have an impact in terms of reduction of mortality of malaria cases on the long run. So having the opportunity of measuring intermediate results allows us to detect if our programs are being effective through our theory of change and immediately take corrective actions if need be. So the example for health, the information that we want to look at frequently is the increased availability of bed nets in health facilities. For education is reduced absenteeism of girls in the north part of the country, because that's the target population that we have. Now we need to transform that information that we need into an indicator that we can measure, collect frequently, and act upon. So we need indicators that are specific and that it can be feasible to collect on a frequent basis. This is an example from health. To monitor the increased availability of bed nets in health facilities, we'll probably have an indicator that looks at quarterly monitoring of stockouts of bed nets in the health facilities that are in rural areas through the HMIS. When we're looking at education, our indicator for reduced absenteeism is probably monthly monitoring of girls' attendance in schools in the north part of the country. Now, these are characteristics of indicators. For the sake of time, I will not go into the details, but you have them in the presentation. Once we have identified indicators, we need to make sure that we have an action that can be taken if the indicator flags an issue. Basically, it's monitoring 101, management 101. It doesn't make sense to collect, monitor, and analyze data that give us information that we cannot act upon. We don't have that kind of resources for which we can collect information that is interesting. We need to collect information that is actionable. And we need to have clear benchmarks that tell us once an indicator provides a certain value or figure, that triggers our action, our managerial action. Finally, in the development of indicators, we need to monitor intermediate results that are likely to change in the short time frame. Again, it doesn't make sense to monitor something that we know is not going to change. When we talk about frequent monitoring, and I think I have it in a slide later on, but when we talk about frequent monitoring, mainly we're referring to something that happens every quarter or so, that can be modified every quarter or so, can be monitored every quarter or so. If you're looking at a change in a policy, which is something that we actually work on a lot, all agencies in different sectors, well, it doesn't necessarily make sense to monitor frequently if a policy is changing. It's a long-term process, is usually followed very well at national level. We don't need real or frequent monitoring for that. It's more for the kind of information that we showed in the examples that is about intermediate bottlenecks or intermediate results. And the other criteria is that data obviously has to be available or can be collected with a reasonable effort. I'll go into that later on. Now, this is a simple diagram that we have used in countries to say if the data for our indicators for frequent monitoring is available, well, then just make sure that the quality of that data is good and you can adopt the indicator immediately. If it's not available, the key question is whether it's feasible to make that data available. And by feasible, we mean that it's affordable, sustainable over time, and acceptable to the government and partners. If that's the case, we need to set up a strategy to assure availability. If that's not the case, we better drop the indicator altogether. So I'm already moving into what are the strategies that as UN agencies we might need to put in place in order to set up, institute this frequent monitoring to better inform our programs to accelerate results. And the first thing, as I was describing, is to assess availability and quality of data. Some indicators may be available, we use them. If they're not available or they have poor quality, we need to come up with strategies to populate those indicators, if possible. Very often this translates into improving the existing information systems, because what we found over and over again is that the data that we have in routine information system, HMIS, EMIS, usually is of poor quality, and introduce innovations in monitoring, above all for real time. And let's make this distinction between real-time monitoring and frequent monitoring. Frequent monitoring is carried out constantly. Real-time monitoring, this is to confuse everybody. Real-time monitoring is carried out constantly, and is sort of a surveillance system. That's one of the good examples of real-time monitoring, and usually it uses a certain degree of technology, sensors on fridges in health facilities to monitor whether the temperature in the fridge is within the range that keeps the vaccines and the drugs effective, or if there are peaks of temperature that might actually turn the vaccines in water, and SMSs to flag immediately if there are stockouts in a facility, or big data now. The U report in Uganda is an excellent example of a real-time feedback from facilities, from schools, etc. When we talk about frequent monitoring, we do not talk necessarily about real-time monitoring. We talk about collecting or extracting information that usually already exists, and that we can collect on a monthly or at least on a quarterly basis to trigger course correction. Okay? So it doesn't need to be real-time monitoring, strictly speaking, to still be very relevant and helpful for our programs. The next step is define the strategy for data availability, quality, and use. And what we have seen and probably Kahal from Malawi will exemplify this for us. But what often makes sense is to have a phase strategy. You can immediately start monitoring the indicators that are available, and then you can expand to other indicators for which you have to improve the quality in collaboration with the government and partners, or improve the availability, and that can also has also to take into account the financial implications of that. And there are two things that we can do in that direction, as I mentioned before. One is to improve the existing data collection systems, and that is the cheapest and most sustainable way. The other one is, very often in countries we have real-time initiatives, for real-time monitoring initiatives, that are implemented in a number of districts or in a region, and very successful, and what can be considered is the scale-up of those initiatives. The last step, obviously, is the costing for these strategies. And both the planning and the costing and the financing of these strategies should feed into the UNDAF or the ONE program. Sometimes we've seen that there is a heavy initial investment, and then the cost is quickly reduced, above all if we're working with routine information systems. And it's important for the different UN agencies to identify common and specific funding sources. And so we went through the whole process, the 3 steps. I know this is a bit intense, it's dumping a lot of information in a short amount of time. As I said, I tried to make the slides self-explanatory so that colleagues can digest them after the webinar if they want to. This is the theory of change that I explained, with the analysis that we do and how we build the information for our theory of change through the analysis. And I want to add the last column there, that is the monitoring of our implementation results and impact. So what is highlighted in this slide in red is what Charles was saying at the beginning. The addition in what we do in terms of monitoring is the monitoring of bottlenecks reduction done more frequently. We already, as individual agencies, monitor implementation and inputs, our activities. We already monitor annually the achievement of the different outputs in the UNDAF outcomes. And annually or multi-yearly, through MIX, DHS, and other surveys, we monitor the impact of our support to countries. What we have not been monitoring is this reduction of bottlenecks or intermediate results that has the potential to accelerate our progress by telling us when our actions are not being effective in order to achieve our outcomes, because we have a clear theory of change that tell us that if we're not effective there, we should not expect to see results. Thank you very much. I think I leave now Gina to manage the conversation. I hope we have Cathal online.
Just before we go there, thank you so much, Gabriele. Let me just say that I think that this is a really useful process because it really takes you step by step through choosing what you're going to monitor on a real time or on a frequent basis. And as you walk through that, then you sometimes with real time monitoring or any adding of technology innovation, we can get a little bit distracted by what is possible because it's possible. So this approach is really useful because it walks you through a process to define what you need to monitor so that you can actually change the programs. And just a word on bottlenecks. Some of you might be wondering why the focus on monitoring bottlenecks. I just want to call attention to the standard operating procedures for countries adopting the delivering as one approach, which came out last year. In those standard operating procedures, there we have the introduction of a focus on progress monitoring, focusing on bottlenecks. The bottlenecks are really key, as Gabrielle said, because that really tells you what you can actually change to improve results as you wait for the long-term multi-year surveys, evaluations, etc., which will give you the actual impact. But in the middle between, is the training done and did it change anyone's lives, it's the bottlenecks that matter. So I'm going to have a look now at the chat.
I didn't see any comments.
Yeah, let's open that up. I think I saw one. Where is that? Sorry.
Do you want to expand the chat like this?
I did see one question. Just 1 second while we pull it up. Not that one. It's the questions. The questions box. Where'd it go? That's the title of the... Just a moment here where we try and find the question box. We had it and now we've lost it. Sometimes the platform is a little bit funky. I know it was there and I saw one question. Can you maybe pull that?
Do you want people to answer?
Yeah.
So sorry about this. We've lost the actual button that opens up the chat, the question box, but we know it's there. So apologies for the moment. So we can't actually see if there are questions. So if you just give us 1 second, we'll pull this up. Where it went? It was there. Wait, there. Click on that thing with the question down the bubble. Yeah. There it is. Okay, fantastic. So we do have 2 questions. Let me just address them now before we transition to our colleagues from World Food Program, who will go into an example of how they're doing real-time monitoring. We have a question from, we got it. We have a question from Carlos Diniz. When we talk about intermediate results, we were talking about outputs. Maybe you just want to address that briefly. And then there's one other question from Alethea Jimenez. Apologies for me. Jimenez. Apologies for my mispronunciation of your name. Alethea asks, will you be sharing the presentation via email? Yes, absolutely, we will, so that you can walk through it at your pace. We're also recording the webinar, so you can curl up with a nice webinar some evening at your leisure. So maybe just briefly to Gabriele to answer this point about the difference between intermediate results and outputs, and then we're going to move to WFP, the example of Emblem. So Gabriele?
Okay, if you look at the column on the right here, where you have the monitoring, implementation results and impact, what we call intermediate results is the reduction of bottleneck. Is that at the level of outputs? It depends. There is a lot of confusion in terms of where we set output outcomes and impact sometimes. Usually I like to think of the output being the increased coverage of the intervention that we want to promote. So the use of bed nets or the attendance of girls at school, etc. While the bottlenecks would come to support that output, the reduction of the bottleneck. So it's somewhere in between the inputs and the output. Some people call the reduction of bottleneck an output and the increased coverage an outcome. I think that what is important to understand each other is that there is flow. There is this clear flow between what we implement, the achievement of intermediate results or reduction of bottlenecks that supports increased coverage of key interventions, the increased coverage and the impact that those interventions are going to have on health, education, reduction of poverty, etc. So I hope the answer doesn't confuse more than clarify.
If it does, feel free to make that clear in the questions box. We can see it now, which is a good thing. We have one more question, which is from Dunstan. Do you have any examples on the business operations strategy? So just to say, largely, I think the approach that is being put on the table here, and which is being drafted in this UNDG guidance, which is underway, can be applied to whatever your objectives are, whether they're programmatic or operational. The business operations strategies, for those who don't know, is an effort to increase effectiveness and efficiency of the operational side, the logistics, transport, IT, human resources, etc., on the back end to support the UNDAF delivery. So if you're interested in applying real-time monitoring or frequent monitoring to your business operations strategy, I would suggest you walk through the same steps outlined here. You'll need a theory of change. You'll need to know, what your assumptions are. If your assumptions are, if the agencies work better together, if they pool resources for IT platforms, they're going to save money. You need to walk through there and see where the bottlenecks might be along the way. So just to focus there, we've got one more question, but I'm gonna go ahead and have a look at it, and then we will delegate it here on our side to the panel. But let's move forward with the presentation from World Food Program. Oh, I'm sorry, Cajo. Apologies, I forgot Cajo. Cajo, if you're there, let's try and enable your mic so you can give us your thoughts. We're opening the floor to Cajo Elder, who's the monitoring and evaluation specialist in the resident coordinator office in Malawi, because Malawi has a real-time monitoring framework for their full UNDAF. So we just want a couple words here before we shift to WFP, and then we'll get back to the questions afterwards. We're just going to...
Sure. Can everyone hear me okay?
Yeah, great. Go ahead, Cajo.
Okay. I think Gabriella kind of covered everything in great detail, but maybe just to give some practical examples of practically how it worked for us in Malawi. What we did was, first we kind of conducted a mapping of all the different data sources that were available on a frequent basis, so every month or every quarter. And based on that, we then had Gabriella, Gina, Charles, and a couple of other people come over and facilitate a 4-day workshop where we processed that Gabriella has just described there. Following that then, because it was quite new and it was a lot to expect, I think, of all the program staff, some of the indicators weren't quite as defined as we would have liked, so we got someone else in for about a 3-week assignment just to go through the indicators with all the outcome groups. And then we really tightened up the indicators and the data sources and the strategies for actually making sure the data was available. So that was, the workshop was in July last year, and then the consultant came in about October last year. So we've really been trying for, I guess, about the last 6 months to make this work. With quite varying degrees of success, I guess. It's definitely challenging, but there are some quite easy wins in there as well, I think. And again, we chose kind of from the start to very much focus on where data is available, and the logic was that there's lots of data being collected and it all goes into these systems, various management information systems, but it's not often used. So we're not taking the data out of systems. So that's where we tried to focus. And we've been doing okay, but it's definitely a challenge. I mean, I think one of the main challenges is kind of changing mindsets. Why we should spend additional time on collecting the information rather than just doing our normal programs. Understanding why the information is useful, why having that data is useful for your planning. And I mean, in terms of why I think it's useful, or what we've tried to communicate, as you saw in the presentation, you can make your programming more responsive. You can adapt. If you identify a bottleneck, you can adapt. And that comes back to having the evidence as well. So you use the evidence, you use the data that you have for making decisions and for planning going forward. It also allows you, I guess, to communicate results a bit better, which is something that we always struggle to do. And if you're waiting every year or every 5 years for data on an indicator, it's quite hard to communicate to what's actually. And then finally, I guess you can use it to inform your advocacy as well. So for me, they're the kind of benefits of doing it. The challenges, like I said, are, I guess, the time there is setting it up, but also then run. And I think where we've struggled a little bit is just the consistency. If it's a monthly indicator, it needs to be collected every month, it needs to be analyzed, and it needs to be disseminated, I guess, so that people can actually use it. And I guess the other thing, which is kind of the whole point of this webinar, is understanding what's actually useful to monitor frequently. And that's difficult, but there are definitely some things out there, and you need things that kind of base. One of the areas where we really struggled to get indicators for was kind of environment and climate change, which is a big area for us. And for a long time I couldn't understand why we couldn't find an indicator, and the reality is it just doesn't change frequently. Look at it every quarter or every month. Deforestation, you're just not going to get that data. So to focus on those areas where there is data available, you can actually do something to change it on a frequent basis. That's pretty much all from me. I mean, I'm happy to take any questions in terms of the practical implementing a framework and how it works.
Fantastic. Thank you so much, Cahal. It's really, really exciting. And for those of you who want to read more, you can read Cahal's blog on the UNDG blog site, Silo Fighters. Just a little advertisement there. So we do have a couple more questions, which I just want to take because I think they address exactly these points. So before we move on, we've got one question from Cristina Ramirez, who's asking about, she's working with 26 agencies in Colombia, which makes it a challenge to develop indicators that are relevant, but also represent the broad range of contributions of the UN system to the country's development. So the question here is, would it be possible to include recommendations on indicators? And I think this is a good question because this is exactly why, Christina, we're developing the UNDG guidance. We actually want, unfortunately, we can't necessarily offer a menu of indicators that we know from headquarters level would both be relevant to your program and would change, in a short period of time, sort of in periods shorter than 3 months. So what the guidance is trying to do and what the process that Gabriele presented here is actually to allow you to set up a process to narrow down what indicators indeed you should monitor for the 26 agencies that are engaged in the UNDAF. Let me then, we're gonna hold on. Sorry, no, we've got one more question from Mahmoud Gul. not sure what country. The question here is, the focus of Gabriele's presentation was on the bottlenecks. So this kind of pessimistic view that we should expect things to go wrong, right? Mahmoud is asking, could we also focus on the enabling factors or the success stories, the catalyst factors? So let me field that to Gabriele and Charles for your comment.
I think that the idea of monitoring the bottlenecks to accelerate progress, I don't think is necessarily negative in the way it's conceived. It's actually a very proactive way of managing programs. Does it make sense to monitor enabling factors? It does make sense to know what are the enabling factors to make the best use of them, sometimes it's interesting to look at the best practices even within countries to expand or to scale them up, etc. Usually what I've seen is people focusing more on the enabling factors when there is an evaluation or a midterm review rather than an ongoing monitoring. Because it's a bit more difficult to pinpoint the enabling factors, and once you find them, you don't have a corrective actions that you have to put in place immediately. Is more sort of a lesson learned for scale up and advocacy. So yes, it's important to look at them. Is it as vital to monitor them frequently to feed that into our programs? I haven't seen so far good examples of that. So if you come across any of those, I would be very happy for you to share them with us. In terms of Cristina Ramirez's question, Gina already answered it mostly. I think you need to prioritize. Not everything needs to be monitored frequently. Not everything benefits from frequent monitoring. So, and I know that sometimes there is the tendency of feeling that if your specific area is not on the frequent monitoring framework, then you are falling off the map. That's not necessarily the case. So frequent monitoring has to be understood as one of the different tools that we have to improve programs. And sometimes decisions have to be made also in terms of availability of resources and the volume of information that we can process, look at, and act upon. In terms of technical guidance on the indicators, there are guidance notes with generic indicators for common bottlenecks for interventions in different sectors. So far, in terms of the joint UN process, we have only developed the generic, I call it generic or conceptual guidance. And the idea was to develop more technical pieces as we move forward and on a needs base and as the needs come from countries. So if you have specific needs for technical support, please flag them to us, and we're more than happy to work together with you on those. Okay.
Fantastic.
I don't know if Charles
So maybe if Charles, do you have anything to add?
I will come in.
Maybe we'll come in. Well, I just want to save some Q&A at the end because we're, as usual, we've probably overpacked this webinar. That's what we do in the UN. So I want to move to. We have another half an hour. I want to move to our colleagues at World Food Program. So again, we have John Martin, who's a team leader for food security monitoring, and Marie, who's a food security analyst. So we'll pull up your slides here and unmute your microphones.
All right, thank you very much, Gina. Thanks for the invitation. We'll talk you through the Emblem and our experience with real-time and frequent monitoring at WFP. So while the slides come up, I'll just give you a word of introduction, and Marie will actually take you through the substance. The insights we offer come from the humanitarian and disaster response area, so it's linked but not the core of an UNDAF, but we hope that all of this will be helpful for you nonetheless. Now, the starting point for WFP is the need to understand changing food security conditions. Food security and food consumption change a lot during the year because of seasonal changes, because of shocks, because of a lot of factors that affect people's ability to purchase the food they need. We have not traditionally, as a I'd say as a community of practice, done a great job at keeping track of people's food security, and traditional food security monitoring systems tend to be cumbersome. Now, the opportunity we see is that right now the technology barrier to implementing automated surveys is no longer there. We have the ability to collect much more information and analyze it in a way that's rational. So that led to the creation of what we call MVAM. So that's what's on the slide, Mobile Vulnerability Analysis and Mapping. Some of you might know VAM, Vulnerability Analysis and Mapping. That's the Food Security Analysis Unit of WFP. We're based in Rome, but have a network of 150 analysts based worldwide. And we work with a series of tools, and increasingly we've worked with mobile tools, and hence MVAM. So we use new tools, but we're also able to calculate new indicators, and Marie will tell you all about that. So Marie, over to you.
Okay. Thanks, Jean-Martin. I hope you can hear me okay. We're just switching laptops here. So MVAM, as Jean-Martin mentioned, stands for Mobile Vulnerability Analysis and Mapping. And MVAM is an added component to our traditional face-to-face monitoring, food security monitoring and assessment tools. And the basic idea is really that short, high-frequency surveys are carried out through live calls, through SMS and interactive voice response system, and using the phones that people already have. So respondents can take part in the surveys from wherever they are, basically. And we ask respondents simple questions about their food consumption, coping strategies they use when they're confronted with lack of food, and food prices. Really, we try to keep the surveys as simple as possible, usually about maximum 10 questions or so. We've noticed that if you have more questions than that, then the response rate declines and people drop out. In the Ebola-affected countries, we'll talk about that a bit later on, we've also asked respondents about their perceptions on their food security situation in their communities. So this was an open-ended question in SMS surveys, and we received really interesting responses and insights that way. And respondents receive 50 US cents airtime credit after a completed survey, and that as an incentive to participate. And the monthly data that's collected is used to track trends in food security and to support WFP's decision-making processes. Next slide, please. Okay, thanks. Now, the advantages of MVAM. I think one of the main advantages that we've seen is that, you know, when you don't need to have boots on the ground, we can also collect data in difficult, hard-to-access areas. We started the project in Somalia and DR Congo at a time when access in these areas was really difficult. And later on, now in September last year, we moved on to the Ebola-affected areas. Turnaround time, we've managed to decrease the turnaround time of our surveys to 1 to 2 weeks, and that's down from 6 weeks, which is quite traditional for our traditional face-to-face surveys. And also the costs have decreased to about $3 to $9 per questionnaire, compared to $20 to $40 for our traditional face-to-face surveys. Next slide, please. Ongoing projects. So the project is active in about 10 countries at the moment. We got started in 2013 in DR Congo and Somalia, in displaced persons camps in Eastern Congo and in central Somalia in the Galkayo region. September last year, we started SMS and IVR surveys in the Ebola-affected countries when access was really difficult. And then this year in February, we started phone surveys, live calls, through a call center in Iraq. And other countries that have come on board now are Chad, Niger, Sudan, and Kenya. I think, this is also the map that shows the ongoing projects and about how many completed surveys we've done up to date in each of the countries. Maybe just to add, I think I forgot to explain about IVR. So IVR is interactive voice response, and that's basically an automated survey. We record the questions in advance, upload them to the IVR system, and then the respondents call in, they hear a question, and then they reply to the surveys pressing the keypads on their phone. Jean-Martin, anything to add?
I'm sure you guys are dying to ask us questions, so maybe we'll leave it there, or.
Yeah, I think those are all the slides. We have loads more information, so looking forward to your questions.
Right, so we also have a blog, and we promised Gina we'd be contributing to Silo Fighters, so keep an eye out for that. Thank you.
Fantastic. That's music to my ears. No, and just to say that I think you have a recent blog post on specifically on the IVRs and the robocalls and where that works best and some of the lessons you've learned in Somalia. So something to look out for on the WFP blog. So we will now. So if there are questions specifically for our WFP colleagues, please put them in the chat box now. Maybe while we're waiting for some questions, I'm just going to abuse the position of the moderator and ask, can you walk us through, since we focused in the first section on how you choose what to monitor in real time, can you walk us through, what kinds of questions you're asking in the surveys and how you come to that conclusion?
Well, we have our traditional food security monitoring systems that have existed for quite some time at WFP that usually focus on questions such as food consumption, coping strategies, also things like income and expenditure. Right now we've changed the approach because the technology requires that. If you want to be doing real-time frequent monitoring, you can't do everything. And our experience with the Emblem showed that we needed to stick to simple, short questions that require short and simple answers. And that allowed us to focus on things like the food consumption score, the coping strategies index, things like food prices. Free text answers on SMS were actually pretty popular. So what we want are, in fact, indicators of how people's livelihoods are changing. And you do see a lot of movement in all these indicators from month to month when you monitor them on a high-frequency basis. And testing has allowed us to understand what measures are actually the most appropriate for a high-frequency context.
Maybe just to add that what we also had to do was to streamline some of our existing questionnaire modules as the project progressed, and we realized that some of the questions we weren't able to get good responses to. For example, the food consumption score, which is quite a complex module, we couldn't ask through SMS.
Mm-hmm. And a lot of the learning has been around what works by SMS, what works by IVR, robocall, what works when you have an operator placing a phone call, because they're all very different experiences, and you would want to roll them out in different contexts. So the answer to your question, Gina, is sometimes you have your wish list, but then it has to fit into the constraints of the technology you use.
Excellent. Thank you guys so much. Okay, so we do have some questions now coming in through the chat box. The first question is from Fumi Nakamura. Are you using any specific software or program for data analysis after you collect all the data from the survey? Or does what you presented also cover systematic data analysis? So this is from Fumi, who works with UN Women in the regional office in Istanbul.
Okay, so this is actually part of the secret sauce, but since we're on a webinar, no problem sharing it. So we have a data scientist on the team who's developed what we call the stats engine. In effect, it's an SQL database that reads the CSV files that have the data, and it does all the calculations of the indicators on the fly. And that makes our job a lot easier because it essentially automates. We've automated data collection, but also data analysis. So yes, there's something we call the stats engine that does that. We're also experimenting with automating the analysis of the free text responses we receive. So in the Ebola-affected countries, people receive an SMS that says, "How is food security in your community?" And they will reply, "Oh, prices are high," or "We had a good harvest." That kind of a response. We've been using an algorithm that reads the keywords in the responses and that classifies them as positive or negative, and therefore the machine can learn on the basis of a dictionary how to interpret these free text answers. So these are the things we're working on, and indeed we've had some progress in automating the analysis as well.
Excellent. Thanks so much. So now we've got another question from Blandine. Blandine works in the resident coordinator's office in Mauritania, which is one of the countries which is trying to develop real-time monitoring for their forthcoming UNDAF. So Blandine asks, how do you verify the information provided by people interviewed?
All right, so thanks, Blandine. Good question. So what we do in every country is essentially, we weren't able to do this for Ebola, I'll be honest with you, but in most countries where we've implemented this project is we do a verification at first, and we compare the results of face-to-face data with mobile data. That's an important first step. What we've seen is that we typically get very good results, and we actually have an upcoming blog post about Niger and Chad that show that when you ask questions by phone or face-to-face, you get pretty much exactly the same results. But we have to go through that in every single country to make sure that we're not missing something or that we're not doing something wrong. I think it gets more tricky when you do things by SMS or by IVR, and we are continuing to learn about effects on your data when you use these new technologies. But essentially, working with call centers and operators has provided very high quality data, provided that the questions, that the interview lasts no more than 10 minutes and that the questions are transparent. But what's really important to do is to set up a validation exercise at first. You can read about what we've done on our blog. We also published an article in Humanitarian Exchange last year about how we validated the data that was coming out by SMS from North Kivu in the Democratic Republic of Congo.
Maybe just to add that in the Ebola-affected countries, what we try to do is triangulate the information collected through SMS with other, for example, price information that has been collected through face-to-face to the extent possible.
Great, thank you guys very much. We've got a question here that kind of follows on that from Dunston, which is, how does no boots on the ground deal with the challenge of the counterfactual? This is along the same vein, if you want to field that one.
Yeah, no, that's a great question, and the challenge of no boots on the ground was actually one that we're well placed to face. As a unit, as the Food Security Analysis Unit, we've been out there doing data collection for about 20 years in some of these countries. So maybe we can't send boots on the ground now, but we were able to send boots out 2 or 3 years ago. We do have systems in place where we work with the governments to collect data. We have either surveys that were, baseline surveys implemented by WFP, or the DHS surveys, or the surveys, the LSMS surveys that the World Bank organizes, and you will find an indicator that is there in two surveys. So you're always the data we collected by SMS during Ebola, we were able to compare to a baseline that was maybe a year or two old. It would have been better to do a simultaneous survey, a parallel survey, but we were able to have that comparison. So it's probably the best we could do considering those circumstances. There's also the fact that the indicators that we use are used worldwide. So I told you about the Coping Strategies Index. That index, the distribution of that data has a typical signature. If that signature is missing when we do data collection by SMS or IVR, we can pick it up immediately. And that tells us that the data is bad quality. So there are quality checks that we can implement in order to make sure that we know what we're talking about. So the counterfactual is either the same country a few years before during the baseline, or it's the same indicator in another country or in a group of other countries that might be similar. So we do have a proxy for a counterfactual. Thanks.
Great, thank you guys. Thank you guys so much. So we've got some more questions, just in the sense of, you know, will we be able to access the presentations, please? Also with a list of contacts for the presenters, if possible. So if that's okay with you guys, please feel free to send me, and then we'll send it around any resources you want to share, or blogs, or links in any way. And we will definitely send around the slides and the recording. So we'll have that. I should say this question is from Maximo, who works in Lebanon, who also has a blog piece coming up on the UNDG blog site, silofighters.org. So I'm using that opportunity to do some more advertisement here, shamelessly. So thank you, John Martin and Marie. We'll now use the last 8 minutes we've got left, just for a round of open-ended conclusions from any of the panelists, and please do put any closing questions you have in the chat box. So any final words of advice? I think we did have one question here from Jordan saying, okay, what's the first practical step we should do? Their UNDAF doesn't start until 2018, so they're actually not even at the very start of the design phase. So Charles, Gabriella, let's start with you. Would you have advice on sort of first practical steps, or any other closing words of advice?
Okay, thank you, Gina. And thank you for the question. I think the key behind all this frequent time monitoring is that you must have a solid theory of change underpinning your program, so that you have the different levels of results, and you can see where you may have pitched your output, and what are the intermediate results in between, what are the bottlenecks that are likely to arise, and so that whole theory of change. But how do you get to that place? Well, the idea is that when you are in a country, you have to start with an assessment to see what is the situation, what are the challenges, what are the problems. And then, what is the government priority? What do other agencies think this should be prioritized? And what the evaluations say from previous work. So all that informs you to understand what are the issues that maybe should be addressed by the UNDAF. Once you formulate that, then you go into a process of formulating what kind of a result chain based on that. And that result chain will tell you the different levels of results that you need to achieve to address those problems. And in those levels, once you come up with a robust result chain, you'll very easily identify the levels where you pitch your output. And once you pitch an output, you know that that's what you're going to be responsible for as a change. But beneath that output, you'll also see the other levels of results that need to happen for you to achieve the output. And that's what goes into your, the bottlenecks, the intermediate results, the critical assumptions, which lend themselves, to the frequent monitoring. And then you proceed to do the process of, identifying the indicators based on existing systems and so on and so forth. So broadly, that should be the picture. Identify the problems, map a robust result framework, and of course, using your strength as UNDAF and everything, where your comparative advantage, identify what should be your outputs, and then what is the theory of change beneath those outputs? What are the assumptions? What are the bottlenecks you are bound to face? And then those then you start getting systems to monitor those closely. And the idea is that at that stage, you need to monitor closely, because if you don't monitor closely, you wouldn't be able to know if you achieve your output, because you don't want to wait until the end of the year and say, oh, I didn't achieve this output. No, the idea is that in between there are those elements, the bottlenecks, the critical assumptions, some intermediate level results that you really need to monitor so that you can know and make decisions to enable you achieve your output. So it's that theoretical framework that needs to underpin your work, and the rest are really details, and they can vary depending on different agencies. But that is the underpinning theory that you need to have in mind as this. Thank you very much.
Thank you, Charles. Gabriela?
Yeah, very quickly, building on what Charles has already said, and this is mainly for Alberto Nata. I think that I've seen this approach to frequent monitoring as it has two main applications, basically. One is if you are lucky enough to be in the development phase of your UNDAF, you can really build this thinking about the theory of change into the design of the outcome areas and in the selection of your interventions. So it becomes an integral part of your plan and of your programs. But that's not the only way to do it. You don't need to wait 2.5 years to start seeing some results. You can apply it even if you are in the middle of the cycle, just by taking stock of what are the outcomes that you have already selected. And in Jordan, you have at least 5 out of the 6 that are on development. The 6th one is on the emergency response to the Syrian crisis, refugees, etc. But on those 5 outcomes, you can really apply this lens without redesigning or rediscussing the whole architecture of the UNDAF, but pinning down what are the key pieces of information that can help you to better manage what you already have ongoing. And that's how we implemented it in Malawi. And maybe touching base with Kahal can be very helpful for you, because he would be able to give you the first-hand real-life experience of applying the approach in the middle of the UNDAF cycle and not at the beginning of it. There are more.
Excellent, thank you.
There is another from Blandine. Again, I think in terms of the generic indicators or list of typical pieces of information that can be monitored in terms of real time, there is something in the making that is more agency specific, meaning not that it's only relevant for one agency, but has been developed by one agency or the other. I think we need to do a mapping exercise and making sure that we share those resources. But this is a much bigger process that needs to be managed here. I'm only providing technical input on it.
So let me hand the floor back over to our colleagues at WFP. Any final words of advice for countries that want to move in this direction?
Yeah, I'd say don't rush it. First of all, I'll really second everything the colleague was saying about having a good plan in place. That's really the starting point. And then check out what others have done. We also have a toolkit of resources that's online that might help you make those choices and move ahead deliberately as you try to do your real-time monitoring. So seek advice and be strategic. Thanks.
Excellent. Thank you so much. So the parting words are even though it's real-time monitoring and it's quicker than usual, don't forget your theory of change. Don't rush it, as John Martin says, and definitely make this part of your overall plan. The danger in this area is really that it's small scale, one district, one set of indicators. When you get the data, you don't necessarily know what to do with it. It's interesting, but you don't know what to do with it. So what we've been talking about here is bringing in the excitement and the fast pace of technology and innovation, but not losing our grounding in the fundamentals of monitoring. So we will close out the webinar now. I know we didn't get to all the questions, but we can create a log of these questions so we can get back to them deeper. As I said, we will send around the recording, the slides, and if the panelists have specific links or background documents that you want us to pull together, we'll do that as well. Thank you all so much. Thanks again to all our colleagues, Charles from UNFPA, Gabriela from UNICEF, John Martin and Marie from World Food Program, and thanks to my colleagues here at UNDOCO for setting this up. Have a good afternoon and evening or rest of your day.
Bye-bye. Thank you.
Thanks a lot. Bye.
Bye. Thanks.